All systems are go. You're clear for
Hello, everyone. My name is Brett Kestenbaum. I'm the COO at Eyes on Eye Care and your moderator for the duration of this session. I could not be more excited to welcome you today to the final round of the 2022 Optometry Innovation Awards. We've been shouting this program from the roofs all year long, but many of you might be thinking, what are the Optometry Innovation Awards? This program was designed to cultivate innovation in the field of optometry. Applicants from around the US and Canada submitted their ideas for a chance to win a part of $40,000 in prize money to assist in bringing their innovations to life. While Eyes on Eye Care is leading the charge on this new program, these awards would simply not be possible without the support of DomPay, the exclusive sponsor of the 2022 Optometry Innovation Awards. Innovation is a foundational aspect of their organization and how they operate. DomPay Pharmaceuticals has found success through the vision and determination of their team in conducting compelling research and creating impactful innovations, a core reason why they are proud sponsors of a program dedicated to those who seek to create cutting-edge products or services in the eye care industry. Now, before we dive into announcing our finalists, let me give you a quick overview of the rules behind the submission process. Applicants were required to bring forth a concept that focused on one of the following key areas: improving patient care, improving workflow and efficiency for optometry practices, elevating the state of the optometric profession, raising awareness among consumers, or enhancing educational accessibility within the eye care community. The submissions were also evaluated and scored based on a set of outlined criteria they had to follow, beginning with providing an introduction to their innovative idea and explaining how it solves a current problem in the industry. They had to provide a market analysis, management structure, and an in-depth breakdown of their products or services, as well as a strategy to get it into the market, including financial projections and an analysis of the possible obstacles they could face. From there, they had to tell us what the prize money would help them accomplish in bringing their idea to life. We're really excited to announce that we had more than 30 entries in our first ever Optometry Innovation Awards, judged by a panel of 5 optometrists and entrepreneurs in the industry. 3 of the judges are members of the Eyes on Eye Care team: CEO Dr. Matt Geller, Director of Medical Education Dr. Michael Cooper, and Director of Client Services Dr. Antonio Chirumbolo. Our other 2 esteemed judges include Dr. Jackie Garlick, founder of 2020 Glance and Envision Optometry, and Dr. Stephanie Wu, founder of Wu University and the Contact Lens Institute of Nevada. We're excited to have 3 of our judges joining us live today to participate in the final round of the award ceremony, where they'll be interviewing our finalists for the last time to determine who our first, second, and third place award winners will be. Before I announce our finalists, I wanted to recognize select honorees from our outstanding list of applicants. These individuals showcase some truly incredible ideas. You can check out more about these honorees and their ideas anytime during the event by heading over to the Innovation Zone found in the navigation bar on the left-hand side of your screen, or if you're on your phone, at the top right on the drop-down menu. We'll also share a link to the Innovation Zone for you right on this page after our award ceremony ends. All right, now let's get this program started. I'll announce each of the finalists by name, share a brief video with you of their concept, and then we'll bring them on live for a final round of Q&A with our judges. And now, without further ado, I'm proud to announce the 3 top finalists for the 2022 Optometry Innovation Awards. First up, finalist number 1 is Dr. Elise Briscoe with her mobile alternative to standard reading glasses. Let's check it out.
I'm Dr. Elise Briscoe, the founder of Nearsight, and I'd like to demonstrate to you our first product launch. I wanted to develop a convenient alternative to reading glasses because either patients didn't like wearing reading glasses because it's a hassle, or they don't want to be seen with them, or worse yet, they couldn't find them when they needed them. How many times have you been with somebody that they can't see something right in front of them and they're looking for their here they are, looking for their glasses everywhere. But it's so important for us to see tiny fonts all the time because we are tied to our phones for a big part of our lives. So what I did is I combined the most valuable real estate of the cell phone with the power of reading glasses to develop the world's first vision-enhancing phone case. Bam, there you go. Never lose your reading glasses anymore because it is part of the case. We have 2 patents a trademark protecting our IP, as well as a proprietary lens. We had a lens designed just for this device because it allows you to see the whole screen without having to pinch and zoom, so you don't lose any critical context. Also, it allows you to see off the phone. If you want to see a little medicine bottle, I formulated this, by the way, for natural ophthalmics. If you want to see labels, menus, programs, you can also use it like this, bring it all the way out. If you want to read a magazine, use it like that. When you're done with it, just fold it back up, folds flat up against the phone, put it into your back pocket, purse, wherever you go, and voila, there you have it. I'm really proud of this because it is not just a reiteration of reading glasses. We're creating a new way to navigate our digital world with something that's simple but powerful, something that almost everybody can use. So I'm Dr. Lise Briscoe, the founder of Nearsight. Thank you so much for this honor of being with my colleagues. I absolutely love optometry. Optometry has been good to me, and this is my life's work. I would like to be able to help people around the world improve their quality of life with the products that we have invented, including something for the myopia epidemic and dry eyes, and really would love to have you partner with me on making a difference in people's lives by putting the power of sight in their hands. Thank you so much.
All right, congratulations, Elise, for making it to the final round. And now let's bring on Elise and our fantastic panel of judges for the first section of Q&A. Matt, what questions do you have for Elise?
Hey, everyone. Well, thank you, first of all, for all the contestants, and it's great to be on this session. I am very, very, very excited to be here. Elise, let's get right into it. I think one of the most important things is ensuring that more innovation comes from this. I mean, that was the whole purpose, as Brett said, of these awards, right? Is to keep that innovation going. So, should you win, what will be some of the things you might do, or just even one thing that you might do to help bring further innovation in optometry?
Well, I'm already a mentor within optometry. I've had a program with UCLA and USC for decades. And I'm an open door. I'm on social media. I invite our colleagues to message me, and I am so happy to walk you through the process. Just got my second patent last night. It is an arduous task, and I can help you get up the learning curve even faster because I am so proud to be an optometrist and want to help our colleagues, promote our profession on a larger scale and show them what we can do.
Absolutely. Thank you for that. Yeah, mentorship is key, and I know future innovators will appreciate that. Coop, I'll hand it over to you for the next question.
Thanks, Matt. My question kind of talks about the resources. Like, what are the nuts and bolts around that? What resources do you think will be useful to innovators in optometry?
A lot of it is connections, helping each other out. What resources can we offer each other? Do you know somebody in this field? Or outside of the field? I drew on colleagues, some of them who are investors and also on my board, to help me with ideas because I'm taking the clinical knowledge that we use and turning them into solutions for problems that are unmet in vision care.
Thank you for that. Appreciate it.
You're welcome.
Stephanie, question.
Over to you next.
Yeah, no, amazing concept. I love your idea. I love how much you're doing for optometry and especially women in optometry being just inspirational to everyone. It's fantastic. And I guess my question is, a lot of people have ideas for products or just any sort of innovation. And I hear that all the time. Oh, I have this idea for this. I have this idea for this. What advice would you give to somebody? Because so many people have ideas. What advice would you give to just taking that very first step that will lead you into actually following through with this plan?
You have to have chutzpah. I'm going to tell you, first of all, this is not for the faint of heart. It's very hard to be a founder, and I've been grinding at this for a couple of years. So I actually sold my beloved practice so that I could focus on Nearsight because I have fiduciary responsibility to my investors. You have to be so passionate about it that you're willing to dedicate your life to it. And if you guys follow me on Instagram, you'll see I live a life of passion and purpose, and I take the road less traveled. But I do see a huge need for optometrists to get out there, be braver, and show what we can do, because we're in the trenches. We can help people with all the knowledge that we have. And now vision's even more of a problem because, like, our meeting is virtual today. Digital is so hard on our eyes that it creates a lot of vision problems. And optometrists are poised to be the best profession to solve these problems.
That's excellent advice. Thank you so much for your pitch, and good luck to you. And back to you, Brett.
Thank you, Elise. That was great. All right, next up is finalist number 2, Dr. Janelle L. Davidson. Her concept is Paradigm, a web-based optical platform aimed at assisting the private practitioner in a multitude of ways to increase efficiencies and revenue. Let's take a look.
All right, Mr. Jones, so it looks like Dr. Davidson has your prescription. All right, based on your benefit, it looks like your copay for single vision is $10, materials copay. Hi, I'm Dr. Janelle Davidson, co-founder of Brilliant Eyes Vision Center and co-founder as well as Chief Visionary Officer of Paradigm Optical Software.
And I'm Jimmy Davidson. I'm also co-founder of Brilliant Eyes Vision Center and also co-founder of Paradigm Optical Software, as well as the Chief Technology Officer.
Guess what? Times are changing. On the consumer side, people want transparency, multiple options, and value for their purchases. On the business side, private optometry ownership has become threatened from multiple fronts. Margins have become thin, thus efficiency and accuracy is where the revenue is going to keep the business alive and thriving. This intersection between the patient's needs and the business needs is where Paradigm comes in. We are a web-based optical platform that checks all the boxes necessary for today's retail landscape. As a practicing optometrist, I have witnessed firsthand the evolution of the private OD landscape. The value proposition is very simple. Paradigm was developed to rectify these many threats to the private practitioner: revenue loss, efficiency loss, calculation errors, training gaps, and a lack of transparency. The list can go on. Our software is one of one in the industry, whether a patient is self-paid or insured. We allow offices to fully customize a bundling model. First, we find the patient's insurance, then we pull the patient's benefit. We present the office specific bundles, and once sold, we can gamify your optician's experience, creating a healthy competition within the office. Our platform has helped me increase my revenue by 30% and increase accuracy 5-fold, all while reducing training time for new hires and increasing the customer experience by offering a clean quotation immediately. Paradigm creates the paradigm shift necessary for the survival in the optical industry.
So why Paradigm is the right innovation to the industry and why we should win? And my wife said it. We're truly one of one in the space with a large potential consumer base. Paradigm simply levels the playing field for the retail aspect of private optometry. Every industry bundles, but not optometry. And it's not that we don't want to, but various insurances have made packaging difficult. So we've eliminated that hurdle with our technology. It's both for good for the business and good for the consumer. It's truly a game changer, and our beta test cases has shown that we've made huge impacts to many businesses. Paradigm is the number one choice. It should be your number one choice as an optometry innovation technology partnership.
Thank you.
All right. Congratulations, Janelle, for making it to the final round. We're going to kick it back over to the judges for Q&A. Stephanie, what questions do you have for Janelle?
Yes, thanks, Brett, and welcome, Janelle, and great job with your pitch. I loved it. And my question for you is, what problem did you see in the optometry industry that caused you to come up with this concept?
So once again, I'm excited to be here. The problem I saw was I was living it. I'm a private practice, independent OD, and the problem we have is efficiency, calculation, and dependency. And so in practice every day, I would have times where staff will call out. Then I have to figure out who's going to calculate the charges. It might be my optician. I wanted to figure out a way to increase revenue in my practice by not necessarily seeing more patients. And so Paradigm allowed me to be able to do all of those things, be able to increase efficiency, be able to package our solutions and create a better patient buying experience for both the staff and the patient.
Excellent. Well, thanks for that. And I love the fact that you're speaking from a practicing doctor that deals with these issues. So you know what everyone else is going through, and to solve a problem like that, I think is amazing. So thank you so much for your concept. Good luck, and over to you, Coop.
Thanks, Stephanie. And I couldn't agree with you more. I think this is something from the trenches that, most of us deal with in the day-to-day. And anytime we can provide more efficiency for our practice and our staff and everyone else in between, it's always a win in any respect for all parties involved. So my question for you, Janelle, is zooming out a little bit from your concept, what are some of the other areas where you think optometry could benefit from innovation?
Basically on the retail side, as a private practice owner, I'm great on the medical side. We get all that in school. But if you own an optical, we need more innovation to make us competitive on the retail landscape. And so Paradigm allows us to do that as well, to create a different patient buying experience. The optical in reality brings about 50 to 60% of your revenue of your private practice. So it's an overlooked area in private practice that there has plenty of room for innovation.
Perfect. Thank you for that remark there. Matt, any more questions you have on your side?
Yeah, I've got a good one. I'm curious your advice to others on just developing a software-based product, right, or a SaaS-based product. How do you go about finding engineers, whether it's friends, family, outsourcing it? I think a lot of people do have ideas that are software-based. I mean, we're on computers and apps all the time, but taking an idea and getting it to function in an application is a different story. So maybe how did you do that, or advice to others on how they can do that?
Definitely. I was blessed. My partner and co-founder is my husband, who is an optometrist engineer with an IT background. And so I had an idea. I said, I'm doing this. Help me figure out how to make it reality. We went from Excel spreadsheet into actually having an interface. And so you do have to go find those resources. I have my hairstylist who's developing an app, and she wanted to know, you have to map it out. Go find a resource that can help you translate from what you have on paper into actual reality through coding and interface. And so my husband was able to help with that. So if you have a family member who has a passion and who have to take your idea from an idea to an actual reality, use your family members and friends, and that help with some of your costs as well.
Yeah, absolutely. We took a similar path. My brother is our CTO and lead engineer. So
okay, good.
Yeah.
So family
advice to everyone.
Exactly.
Yeah, have someone go get their computer science degree, and it'll work out.
And utilize.
All right, back to you. Yeah, thank you so much, Janelle. It's a real pleasure having you on here, as well as the other contestants. Wish you the best of luck. Brett, back to you.
All right. Thank you, Janelle. That was fantastic. And last but certainly not least is our third finalist, Dr. Janice Luck, with her innovative product, Ithos, a lash restoration mist. Let's take a closer look at this one.
Hi everyone, my name is Janice Luke and I'm an optometrist that was born and raised in Toronto, Ontario. I am currently practicing on Vancouver Island in beautiful British Columbia. I am so grateful to be a finalist on the first Eyes on Eye Care Innovation Award, so thank you so much in advance for watching. We already know that beauty trends are highly sought after by patients, whether they be lash extensions, eyelash tints, eyelash lifts, tattoo eyeliner. One of the more common beauty trends that I see in practice are eyelash extensions. Eyelash extensions are semi-permanent makeup where individual synthetic fibers are stuck onto the patient's eyelashes. These can take upwards to 2 hours to apply, can cost upwards to $200, and can last upwards to 1 to 2 months on the patient. It is no surprise at all that patients will try to protect their very expensive lashes by not disrupting them, not touching them, and ultimately not cleaning them. And oftentimes, patients will still apply makeup over top of these very dramatic lashes. So what exactly is the problem? Even if patients are cleaning their lashes, they don't know if they're doing a good job, and they don't know what products they should really be using. This is precisely why we start to see patients in our chair from things like allergic responses, styes, infections, or dry eye disease. So what if we could educate patients before they ended up with the problem in our chairs? Our first product, which is still in formulation, is the Ithos Eyelash Cleanser. This is a formulation that contains ingredients that are friendly for the ocular surface, can cleanse lashes, real or fake, without removing lash extensions. Starting with our eyelash cleanser, we hope to grow into a line of eye-friendly makeup products and makeup removers. Ithos' mission is to create products that can help bring education and awareness to the fact that ocular health can be affected by beauty trends. Our goal is to empower patients to make educated choices about their ocular health and the beauty trends they choose to use. My dream for this passion project is that it will become an educational tool for both patients and practitioners to use. What would we do if we won the prize money? If we were to win the prize money, we would utilize the funding to create clinical research in the form of a case report to support all the claims on the Ithos bottle. This clinical research could further use to educate patients. Thank you from the bottom of my heart to Eyes on Eye Care for creating such an amazing award, and good luck to the other 2 contestants. Do you want to know more? Let's connect.
Congratulations, Janice, for making it to the final round. And we are going to kick it back to the judges one final time for Q&A. Let's start with Coop this time. Coop, what questions do you have for Janice?
Yeah, thanks, Brett. First things first, Janice, great job with your presentation. And it's a very interesting concept here because obviously you're bridging the gap between ocular surface and aesthetics. And I think if people watching the video, they saw that point about empowerment and education. So I want to kind of hit on that part there with my question. What inspired you to create your innovative concept?
First of all, thank you so much for having me. I'm so grateful to be here. In terms of what started this, it was what I was seeing in practice. So looking under the microscope, you see more and more patients coming in with lash extensions and all these beauty trends. And it's almost like an underserved market just because we don't spend the time to educate patients because we don't really know what's out there. And it's super beneficial for us to have a product that we can just direct patients to instead of just having chair time and not talking about things that we should with patients.
Perfect. Thank you for that commentary there. Matt, do you have any questions?
Yeah, I'm curious your advice to others looking to develop a product in eye care, right? Like, what have been some of the most challenging aspects that they should look out for if they're trying to get a product like yours to market?
I was very blessed as well. I find that we are very good at being clinicians, but we don't have the aspect from the business perspective to make this happen. So getting in touch, like Dr. Davidson said, with connections is super, super important. Making use of all the resources in your life, whether it's your husband or whether it's friends. I had a lot of support from the accounting side as well as from someone who's already been in this space, in the aesthetic space. So I got a lot of help from everyone around me.
Yeah, that's the critical piece. You got to just ask friends, jump on LinkedIn, find mentors. A lot of people are willing to help. So, Steph, over to you.
Awesome. Well, Janice, great presentation. I love the branding. Everything is beautiful. And I love that you saw a problem as far as all these patients that were coming in with eyelash extensions or maybe waterproof eye makeup or mascara that they just never washed off. You know, all these issues that we see as eye doctors, and that's not something we typically really learn in school, is how to address some of these beauty trends and things like that. So I'm so happy that you came up with this. And my question for you is, besides the Optometry Innovations Award, do you have any other advice for other innovators that are looking for funding? I think a lot of people, they have lots of ideas. They have nowhere to start. You know, would you say use your savings, get a loan? What are some other resources that maybe people don't think about?
So that's a very good question. I'm still very new in this space, but one platform that I find is very beneficial is Kickstarter. I've heard great things about it. So this is for, I guess, clinicians or whoever else who's interested in having an idea to pitch it out there first, get the funding without having to use their own money or savings or get a loan. And that way the idea can get out there and you can see if it has legs before actually putting in your own funding into it.
Oh, that's a great idea. And I think, correct me if I'm wrong, but you put this kind of idea out there and you have like a certain goal, let's say it's $5,000 and people pledge a certain amount, but I don't think they actually have to pay unless you meet that goal or something. Is that right?
I believe that's the model, but correct me if
Yeah.
I'm wrong too.
So then I think that gives people that are giving money a little bit of, I guess, confidence that they're not just putting money in something if it doesn't raise enough that it's going to just go toward nothing. So I absolutely love that idea. Thank you for sharing that. For anybody listening in that maybe has an idea and doesn't know how to get funding, I love that. And congratulations on this product and good luck with everything. Back to you, Brett.
What a phenomenal group of finalists. Congratulations to Elise, Janelle, and Janice for making it to the final round. While our judges are taking their final remarks into consideration and tallying the scores, it's my honor to introduce you to Jennifer Cross, Senior Director of Field Marketing, KOL, and Peer-to-Peer Strategy at DomPay US. Jen, thank you so much for joining us today to talk about DomPay and how innovation truly drives your organization.
Thank you so much, Brett, for having me here today. It has been so fun to see the Eyes On meeting continue to evolve. And it's funny, I feel like the DomPay US and Covalent team are growing up together, and I'm just really honored to be a part of this.
Likewise, and we're so happy and thankful for DomPay and your organization, especially for hosting and sponsoring and supporting this DomPay Optometry Innovation Awards. So that we could really bring new innovations to the eye care industry and support all these people who are working so hard to get their ideas out there. All right, to start off, Jen, tell us a little bit about DomPay and why you're so passionate about innovation.
Yes. So as I mentioned, DomPay US and Covalent are growing up together, but DomPay is not a new company. It's based in Milan, Italy, and has been innovating for over 130 years. DomPay started out as a group of pharmacies and transitioned into a biotech company. But DomPay is really special for many reasons. It's a privately held, family-owned company, and because of this, we're really able to make decisions decisively and truly focus on the long-term research and development strategies for unmet needs. DomPay is also a very unique place to work, where everyone can unlock their potential while raising families. We really allow our team to expand their roles and explore their passions and grow their careers, which has led to so many great ideas. The DomPay family is also a very special one. Last week, I had the fortunate opportunity to spend time with Sergio DomPay and Natalie DomPay, a father-daughter duo who lead our company. And they just give off this overwhelming sense of love and inspiration. Sergio spoke about times where he had to make difficult decisions and take risks, and how he never takes anything for granted. But at the end of the day, he, does this and wants to innovate so he can try and develop therapeutic solutions in new and unexpected areas to really improve patients' lives. And that's exactly why I am so passionate about innovation. I want to bring solution to doctors so they can better be better doctors, and that they have more to offer their patients for difficult diseases. And at the end of the day, my favorite part of my day is when I get a call from a doctor and they share with me the patient's success.
Yeah, Jen, we love that. And it's so great to hear the DomPay story. We have so much in common. We share a lot of those traits about trying to drive patient outcomes forward. Can you tell us about some of DomPay's latest innovations and research?
Yes, absolutely. So when Sergio took over from his father, he knew that in order for the company to be innovative, we must be in the biotech space. And that is just what he did. He created DomPay Biotech to really become the heart and core strategy of the future of DomPay. And since 1993, the company built and now runs its own biotech plant for recombinant proteins used in the treatment of rare diseases. And following the development of the plant, the company develops, produces, and commercializes one of the most important biotech innovations for eye care based on nerve growth factor. And this protein was discovered by Nobel Prize winners Rita Levi-Montalcini and Stephen Cohen. And today, this proprietary process has enabled Dompé to be the only company to manufacture recombinant human nerve growth factor. And in 2018, the US FDA granted Oxervate a breakthrough therapy designation, enabling Dompé to enter the US market with an FDA approval. So in addition, we are invested in the growth of our neurotrophins platform. In fact, our research team has spent decades unveiling the potential applications of nerve growth factor and brain-derived nerve factor. And we've taken this knowledge that we've learned of the mechanism of nerve growth factor and really furthered our research platform specifically within the anterior segment with several ongoing clinical trials. And this includes furthering data in neurotrophic keratitis, Sjogren's dry eye disease, and neuropathic corneal pain. In addition, Dompé has also seized the potential of bioinformatics by developing a platform called Escalate. And Escalate leverages the power of supercomputers. And this technological advancement has really transformed our drug discovery process, making it more efficient to develop personalized therapies based on the characteristics of individual patients, especially in disease states that still face unmet therapeutic needs.
So Jen, Dompé's ability to constantly evolve as well as the vision and determination to create impactful innovations is inspiring. Is that what led you to being involved with the OIA Awards and helping to bring these contestants' innovations to life?
Yes, absolutely. It's important to the team at Dompé that we support innovation within eye care. It's paramount that we work together as a community to overcome challenges and foster growth to help patients live better lives. We're extremely excited to be a part of this incredible initiative, and I look forward to hearing about the innovations brought forth. And I just want to congratulate all the contestants and thank the Eyes On team for the opportunity to sponsor this innovation initiative. So I hope everyone enjoys the rest of the meeting.
Well, Jen, thank you again for taking the time to join us today and share some insights into Dompé and for all you do in supporting innovation in the industry.
Thank you, Brett. Good to be here.
And now, what we've all been waiting for, the judges have finished their deliberations, and it's my pleasure to announce the first, second, and third place winners of the 2022 Optometry Innovation Awards. As a reminder, third place receives $7,500, second place will receive $12,500, and first place will receive the grand prize of $20,000 to help further their innovation. All right, now let's go to the envelopes. Okay, let's see. And in third place, we have Dr. Janice Luke. Congratulations, Janice, on receiving third place. And let's see here. Let's get the envelope for second place. And in second place, we have Dr. Elise Briscoe. Congratulations, Elise, on second place here. And that means we have our first place grand prize winner is, let's see if it's a surprise, Dr. Janelle Davison. Congratulations on winning first place at our first annual 2022 Optometry Innovation Awards. Congratulations to our finalists for their hard work and dedication to providing innovative new ideas to the eye care industry. Once again, a huge thank you to our panelist of judges and to Dompé for making this program possible through their sponsorship support. Innovation in optometry is such an important piece of improving patient care and sight across the world. As our first inaugural Optometry Innovation Award, this was a huge success, and I'm excited to all of the submissions for next year. If you have an idea, I would encourage you to get it started and see it through. There are incredible people in the industry who can help you get something off the ground, like these fantastic finalists that we've had here today. And the Optometry Innovation Awards made possible by Dompe are really a great way to help you realize your dreams and continue to push the limit on how the industry can help patients across the globe. Don't forget to check out the Innovation Zone for more details on the program. For those who want to know more about innovation in eye care, download the 2022 Innovation Report. Thanks again, everyone, for tuning in for the 2022 Optometry Innovation Award ceremony, and enjoy the rest of Eyes On 2023. So long, and congratulations again, everybody. Take care.